Now we will begin an eye examination on Trace here. I would usually start with a brief history, ask the patient if they had any current conditions, see if they had any corrective lenses, a chronic history, such as diabetes per se, to let me know where the location of the pain or irritations is at and what the symptoms are, if there's any burning, any pain, any itchiness. After that, I would put gloves on, but since we are going through a crisis right now, we will palpate that area like this. We will begin by palpating the frontal bone, seeing if there is any false movement, any pain, any numbness, tingling. Go down to the orbital area, orbital region, to the nasal bone, down to the nasal cartilage. Any movement, again, pain, numbness, tingling. To the zygomatic bone, to the preauricular region, to the temporal mandibular joint. At this instance, I would have the patient open his mouth wide. Go ahead, and then go ahead and close to see if there is any. If I felt any crunchiness, popping, or heard popping, if there is any maltracking of the mandible while he was performing this. I'll also go palpate the mandible, and then the frontal bone, and then his hyoid bone. See if there's any false movement, any pain with that. After I perform this, I will perform the pen light test, which I would have the patient close one eye, yep, there we go. And then I would put the light into his eye to see if there is any constriction of the pupil when the light is in his eye, and then if the pupil dilates as I remove the light from his eye. Okay. Nice. Go ahead, cover your other eye. Open wide. All right, nice. Now no, head relax. I would do this to see if there is the pupils dilate and constrict at an equal rate. After doing this, I will do a tracking test. I will have them follow the pen without moving their head in all directions to see if there is any restriction of movement in any of the eyes, which could indicate an orbital fracture or any cranial nerve damage. Also, if there is any reduction in speed from one eye to the other. Go ahead, follow the pen without moving your head, please. Nice. The patient did well. Now we can proceed to having a Snelling eye chart test. Like I said before, we're going through a crisis, so we don't have a Snelling eye chart. But if we did, we would have them stand at 20 feet from the chart. The patient would do the test 3 different ways. First with one eye closed, then with the opposite eye closed, and then with both eyes open. They would read the chart from top to bottom, and until they reach a level to where they mess up, then we would go to the previous line, indicating that is where their vision lies. If the person can only read the very top line, which is 20 out of 200, that indicates that the person then sees at 20 feet when other people can see that at 200 feet. Usually the best place to be is at line 8, which is 20 out of 20, which indicates that the patient sees at 20 feet what other people also see at 20 feet. Okay? After doing that, we will do a ophthalmoscope check of the eye. I would like to place, if I'm checking their right eye, I will have the ophthalmoscope in my right hand, place my left hand over their forehead, over their frontal bone, so that way in case I happen to get too close while I'm looking through the ophthalmoscope, I don't bump foreheads or into the patient. We got our readings earlier. My numbers were 6 for close up and -1 for far. So I would use 6 for now. I would have to indicate the patient to look ahead, go ahead and stare at the O. And I will go in directly. Okay. I will then be looking at the back of his eye, looking for the fovea, which is a darker area of the eye, which most of the visual activity happens. We'll also be looking at the optic disc and the optic cup. What you want to see is a pinkish background and like similar to veins going in and out where they connect into one area, which is the optic cup. You don't want to see is a cloudiness, kind of like a cloud. What can I say? Like a detached layer, because that could indicate a detached retina. When you're also, before doing that, you could look at the area around the eye, see if there is any what's the word I'm looking for? Discharge. If there's any discharge, any wateriness in the eyes, any pus. If there's a sty on top of the eyes, on top of the eyelids, anything that can indicate pink eye, the shape of the pupil. If it's like a teardrop, it could indicate detached retina, detached globe, and a corneal laceration, stuff like that. You also want to see if there's any hyphemia, which is, I think I pronounced it right, any bleeding in the anterior chamber of the eye. Luckily the patient appears to not have any of these symptoms. A step that I forgot to do while palpating was the teeth, see if there was any damage done to that. I would have the patient open his mouth, see if I can see any fractures, any damage to the teeth. If I had gloves, I would actually go ahead and close your mouth. I would actually have place my hands within his mouth and press on each individual teeth, apply pressure to see if there's any pain, any false movement with that. I could also place my fingers at the temporal mandibular joint and have the patient open his mouth to see if I can again feel any popping or any abnormal sensations that might indicate a temporal mandibular dysfunction. But luckily the patient appears to be fine, and that is it. Thank you for turning off the video, Chris.